Good afternoon, everyone. Thanks very much for coming to this session. Lovely to see you all. We're going to talk today about patient and public involvement in rapid evaluation and what it means and how it can be done. We're very positive it can be done. Lots of us have survived a good 5 years worth. Is it on? Lots of us have survived at least 5 years worth of rapid PPIE, which we're going to talk about today. So thank you all for coming. We're going to run this as a very informal, interactive session. There is a recording which will be available, but please don't let that hamper you from being honest, sharing your experience, asking questions. It's a real privilege to be able to hold a session like this entirely devoted to PPIE, so please feel free to contribute along with us as we go through. We're going to have a series of presentations with some interactive bits during it. We're going to use Slido for that, and also the conventional hand in the air approach. So if your phone battery is flat and you're saving it to watch YouTube on the way home, don't worry, it doesn't get you out of participation later on today. So just to start, I'm going to introduce our panel today. So we have Paley. Paley is the Senior Research Project Manager and PPIE co-lead for RESET, which is one of the NIHR Rapid Evaluation Centres. And Raj next to me. And Raj is a co-PPIE lead for RESET as well. And they're going to talk a bit about their experience. My name's Jenny Newbold. I'm a research leader at RAND Europe, and I am a co-PPIE lead for BRACE, which was one of the other rapid evaluation centres. And we are the old school in terms of rapid evaluation centres, because there's now 5. There were 2 which started 5 years ago, and we're really pleased that both our centres have been recommissioned and just started another 5-year term in October. So that's a little bit about us. So without further ado, I'm going to tell you a little bit about the session today. So we're going to cover what is PPIE from a research point of view. What does it mean to Raj as someone with lived experience as a PPIE person himself? How does he feel about that? Why should we do it? What can it offer research and particularly rapid evaluation, given the conference that we're at today? How can you do PPIE in rapid evaluation? And we really want to hear from you. As I've said, we really want discussion, questions, thoughts, reflections. There's no silly comments or silly questions. Please feel free to contribute. I think we can all learn from each other, which is what the idea of today is all about. So first of all, we just ask you either to put your hand in the air, and we've got a roving mic, or to just put onto Slido, what does PPIE mean to you? Anyone brave enough to give their personal view? Yeah.
I'm a PPI person, and to me it means contributing and making a difference to a particular project, and also, sorry, can you hear me, everybody? Yeah. And also gaining from the experience and learning from the experience as well. So I find it a very useful thing to do, especially when it's co-production and co-production done properly, rather than co-production that actually isn't co-production at all, but it's just they've included it and they think they're doing it, but they're actually not doing it and they don't realise they're not doing it. And I find that very frustrating and don't know how to overcome that when you're in that position. So that's something that I would like to talk about or find out about how that could be overcome. And that isn't with RESET, I have to say.
Good to qualify that. No, that's really good. And one of the things I think we should all bring to the table is different experiences from different projects and different work streams. Some may be rapid and some may not. Yeah.
Yes, I'm a PPIE member, and I think our voices play a very big part
Yeah.
in research, evaluation, and for the healthcare professionals
Yeah.
to know what is it that the patient why the patient would actually want to healthcare.
Yeah,
I'm
absolutely.
very passionate about that.
That's really good to hear, and really nice to have voices in the room of people who are PPIE contributors as well. And we'll explore that more later. I think that will be really good to hear your reflections as well as we go through the session. Great. Oh, we've got some good responses here. So what does PPIE mean to you? Person-centred care, sharing of power, the value of lived experience, valuing all experiences, patients' voice is paramount, valuing lived experience and diversity, learning, truth to power, inclusivity and participation, equal participation with an exclamation mark. I like that. We're enthusiastic. Equal participation, community-driven services and collaboration. So thanks all. That's a really great common ground to start on, I think, and some really sentences that really resonate there. So I'm going to go over to Pei Li, who's going to start us off. Oh, sorry, Raj, who's going to start us off today.
Thank you, Jenny.
I think you need to get quite close to that.
Okay. So, good afternoon, everybody. I'm Raj Mehta, and I think, thank you, Jenny, as you introduced me. So let me tell you a little bit about my background and role. So I've been a PPI contributor to research programs since the inception, really, in 2018. My professional background, I've been in oil industry. I worked for BP, where I had senior leadership roles in the areas of procurement and IT. And the most of my life I've lived with sight loss, and since I retired, I suffered from some other long-term chronic conditions, which were really rare chronic conditions called myasthenia gravis and CIDP. But these actual experiences really kind of strengthened my passion and, really in health and social care. And as such, I have been involved as a PPI contributor about 8 or so years now. So we'll start with really exploring, and some of you guys have already indicated what PPI is. So what is the definition of PPI? So when we talk about PPI, so many different terms people use: public and patient involvement and engagement, public contributors, public collaborators, patient and public involvement or involvement on its own. When we in research use PPIE as all of those terms, sometimes people also include service users and carers in this group. So we're talking about everybody in that sort of group when we're talking about PPIE and what does it mean from a researcher's point of view. So in defining the PPIE, we kind of see in our experience from the research program is as follows. At the base of the triangle, you see, we will inform people, or the public are informed about the research. So effectively, at this point, you're really kind of saying, yes, I have done this. I've actually informed the public. Does it mean much more? And that's the question we continually have to ask, why are you just informing? And then the next stage is, you do the research with the public in a way where you're consulting them and you're actually asking questions. How would we do this, or how would we? And again, here it's at least it's moved up a little bit. You're consulting people, and then you go up further back. And this is where we actually believe all these terms: co-production, co-creation, working collaboratively, etc., comes in for us. So in research, we see this as working together with researchers collaboratively to really both do the study and to actually also advise the research organizations. So that's really what we mean by PPIE. So if we move to the next slide, I think we're sort of saying, why PPIE? Why does it matter? So from a research point of view, before we actually before we talk about why you have to involve, we need to think about some of the questions. What is it that you want people to be involved? Why do you want them to be involved? What are they going to do? And what do you want to find out from them? How will you go about actually identifying who you want to work with and why? And you also need to understand which are the kind of groups of people you're going to do this with. And then finally, you also need to understand where will you recruit these people from. But then coming back to why will you do PPI? Why does it matter? And the first thing is really, there's quite a number of things, but really actually touching on some of the messages from this morning. We're talking about, in a sense, relevance. How do we, what public contributors will bring is the relevance to the study or to the thing, whatever the research you're doing, it chimes with and it actually addresses the demand and the concerns that the public have. The next bit is the quality. The reason it is vitally important is to actually have both the transparency and the accountability. All of us in this room, as taxpayers, have an understanding of why it is important for where the research is done and whether it's done in the right sort of way, etc. So you need to be transparent, you need to be accountable. And then the third thing is really about impact. All the studies as they get completed, how do they get transferred in a language that is understandable by the public? And there's such a big role to actually ensure that the language and the research is actually done in a manner that's understandable by everybody and it becomes real. And it's about accessibility and about reach. So it is getting to the people who actually matters, underserved or people who are underrepresented, making it accessible to people in a different formats that actually works for them. And then it is about really, quite often a lot of the funders, it actually improves your chances of getting the funding approved if you have the public collaborators in the way you have done the research. So if I think about my own experience of why it matters, and what actually should happen, I think for me, the first thing that always comes to my mind is, we've all come across these terms: nothing without us, nothing for us without us. Similarly, why do research to people? Why don't we do research with the people that matters? And that, to me, then sort of says the way you would do it is to actually have people from the inception and have these the maximum impact to make that happen through early involvement and to actually have that impact through the all stages of the life cycle of the research, whether it's an evaluation, whether it is a whole evaluation and followed by implementation. What you get by involving these public contributors and the users in the end of the services is actually an early buy-in to these studies or the changes that we will make to the services, and actually raises the awareness of that. So it actually then, when we come to implementing, it becomes such a simple way to actually and make it go smoother, and eventually, really, in a sense, back to this question about any research without the public contributors or the people that it actually impacts, really is likely, if you don't involve them, it's likely to be extremely bumpy and difficult to achieve the changes you want to make. And of course, all of these is actually very cost effective if you do it in the manner that people who are going to use it, you end up using the service that you're going to implement. So we will pause here for a minute and then...
Thank you very much, Raj. We'd just like to have a space for reflection, really, particularly those with lived experience themselves, to share their experiences, if there's anything that they want to say, or any other general reflections. And then Paley's going to talk about the sort of researcher perspective. Then we'll bring them all together in our discussion at the end. So any questions, reflections at this point?
Thank you. I'm Zoe Newman. I'm a senior nurse with 30 years' experience in the NHS this year, and I currently work for NHS England within an improvement team. And I think that my reflection about the early involvement is absolutely key.
Yeah.
Too many times we get service users and patients and the public involved too late, or it's
Yeah.
a tick box exercise. And this is whether it's feedback, research, evaluation, or even setting up a new service. And I think that we don't do it very well
Yeah.
at all. And I was recently involved with an organisation who was setting up a new service, and there were senior clinicians, improvement managers, directors, execs, and they were having a conversation about the title of the service. And they did have a really, really advocate, a really good patient advocate, and he just put his hand up and he said, "This is irrelevant," he said, "because you're discussing for hours what it should be called,
Yeah.
but what we need to know is what it does and where it is in the hospital, and then it's
Yeah.
signposted in every manner that we can find it." And it was just so poignant.
Yeah.
And I think that my reflection is, Raj, I completely agree, that early involvement and to add value, not to just be a tick box exercise. And I think that's something we really, really do not promote in healthcare. So
Yeah,
it's hence why I'm in this session, I suppose. So thank you.
Thank you, Zoe. Thank you. One other comment. Do introduce yourself when you get the microphone.
Hello, I am Sophie, and I recently joined one of the rapid evaluation centers in Birmingham. And I have a question, actually, rather than a comment. Starting this type of work and doing this type of evaluations, if anyone, and specifically like PPI contributors, have examples of like projects and moments where like researchers have done it really well to involve you in a project?
Good question. Any reflections, Raj?
So yeah, I mean, Sophie, your number of ways we do it, and I think what you find is in projects you will find there are people with experience of having done these kind of things, and then you'll find people who are new to public contributing, and always what happens is the way the researchers work with you, and the way we talked in the morning about relationship. And that relationship, building that relationship sometimes takes time, but once you have that relationship, whether you're new to this project or not, it really, you get to learn and you get the confidence to work with people because they will acknowledge your contributions, whatever you need to say.
I could just give my experience of that. I'm Amanda, I'm a PPIE member. In that it's really, I've been on 2 of the Reset projects. The first one was with the first 5-year one, and I wasn't involved in every weekly meeting. I was involved every so often, and I didn't have a full grasp of the project and wasn't able to contribute properly. And I felt like a bit of a failure at the end of it because I think I could have made a big contribution and changed some of it. The second project with the new Reset, going forward, I'm invited to everything. And it means I've got a much better handle on what's going on, and I'm able to make more valid decisions or advice, and I also learn from all the members that are there and have a much wider understanding, and I've been able to be involved with the other organisations that are involved on the study. So that's made a massive difference. And also they take everything we said, we just treat it as part of the team, which is great. It makes a really big difference to us as individuals.
And that's the dream, I think, for all of us, that we all feel like one team, that we all bring different hats and different experiences to the team, like you do in a project team. They have the economist and the social scientist and all the others. Like, we're all coming to the table with different things, and where we can work together, I think we can really build from that. That moves us really well onto Paley, who's going to talk a bit about her experiences.
Thank you, everyone. My name is Pei Liang. I'm a Senior Research Project Manager of NIHR Reset. So very briefly, who we are we? We are Rapid Service Evaluation Team. We are funded by the NIHR, which stands for National Institute for Health and Care Research. So we were initially funded for 5 years from 2018 to 2023, and then we were commissioned again after submitting our application. So we are now in our second round of reset from 2023 to 28. So RESET is led by Professor Naomi Fuller, based at UCL. We are a collaboration between UCL, the Nuffield Trust, and University of Cambridge. So our aim of the team is to rapidly evaluate new health and care services and policy. And for us, PPIE is central to all of our work. It's very, very important to us. So I just wanted to very quickly pose this question to you. So what are the key stages in rapid evaluation to get PPIE input? Feel free to use Slido or raise your hand. Oh.
I think early engagement with the people that are meant to be on the receiving end of this to help shape the whole thing. It's very, very important.
And I'm just going to read a few of the ones out that we've
Thank you,
got
Tina.
here as well. So we've got analysis of, they're jumping around as I speak, Raj. We've got planning, research design, shaping questions and methods throughout the process, absolutely, dissemination, scoping, input throughout, priority setting, analysis of findings, initial stage conception, and I think the gold star goes to the person that put all stages, because I think that really does sum up actually back to what you were saying at the back there, Zoe, like actually from the very beginning, if we're asking the wrong question that is completely irrelevant to the patients and the participants in our work, then actually we're not going to get much further.
Yeah,
Hayley.
so it seems like key stages equals to all stages. So let me move on to our next slide. So very briefly, the PPIE structure for our Rapid Service Evaluation team. So we have 2 levels. On program level, we have PPIE input from as part of the executive management group that meets monthly. And then we also have our dedicated PPIE panel. We also have PPIE representatives and third sector organization on our advisory board, providing independent advice throughout the whole program. And then we also work closely with partner organizations such as, like National Voices, Health Watch, or the Patients Association. And on project level, so we are a program, but we have given topics by the NIHR to evaluate. So we call those new topics or new innovations that we evaluate, we call them projects. So on project level, we have the project team. So we have PPIE contributor as part of the project team. We will also invite PPIE to sit on the evaluation advisory group for that particular project. And then we also do wider engagement to get broader perspective from members of the public. So, like I mentioned, on program level, we have the executive management group. So there are 2 PPIE co-leads, that's myself and Raj. We are both costed our salary in the funding application. So we kind of like formally employed to do PPIE activity. We have a panel with 9 members that we meet 2 to 3 times a year. The advisory board, which we meet twice a year, as well as a partner organization that we engage whenever we think it's key points to engage with them. On project level, so because we are doing rapid evaluation, so how do you do rapid? We tend to do it in an intensive kind of manner. So we meet on weekly basis, and then we bring in our PPIE to join the project team, and then we meet every week, just like what Amanda was just sharing her experience. So on the project team, so that's they will always have a PPIE co-lead, either myself or Raj, a project manager, patient service user, members of the public. And then in terms of evaluation advisory group, because we want to ensure there are some independent advice to the evaluation that we carry out, we always set up an independent advisory panel to give us advice. So we will have third sector organization representatives on the panel, as well as patients, members of the public, or those with lived experience. And finally, wider engagement. We have a pool of PPIE group that we could engage from time to time. We also host ad hoc workshops at key points within the project duration to engage with wider members of the public or service user to get their input to help shape our study. And finally, also very important, work closely with communities and third sector organizations. So this is just a typical project cycle. So earlier on the question we asked, what do you think are the key stages to involve PPIE? So we try our best to involve PPIE in all stages throughout our work. So from the very beginning, there's discovery phases where we assess the feasibility, whether this evaluation is possible to move forward, whether the innovation is ready to be evaluated, and then we move on to scoping phase, where we engage with key stakeholders, talk to like national stakeholders, third sector organizations, and have wider communication engagement with people with lived experience, and so on and so forth. So we incorporate, we'll have PPIE input throughout the whole project cycle. So moving on to how do we do PPIE in rapid evaluation. So like I mentioned earlier on, we include PPIE contributors as part of the project team. We have clear roles and responsibilities to them. So we work in equal partnership. So we have an equal seat, equal say at the table. We listen to everyone. I think that equal power dynamic is really important. It empower and encourage them to raise their hand, to raise point, just like what Sarah, you're giving the example. If your PPIE advocate didn't feel they have the power to influence the discussions, they wouldn't feel comfortable to raise their hand, to raise that point. So I think that is a really key to have the clear, defined role, and as well as equal power, so we can make a shared decision throughout the whole project cycle. And in rapid evaluation, we felt that regular meeting really helps, even though we know that it takes time to build relationship. But if you intensify it a little bit, so instead of meeting once a month, you meet on a weekly basis. From there, you build the relationship slightly quicker, and then you also build that trust with the people that you work with. And finally, an opportunity to contribute, being able access to all the project documents. So when you send it out to project team, to send out to researchers, do send out to PPIE as well, because they are part of the project team. They are not just another group of stakeholders that you engage with. They are part of the project team. And a range of ways to get involved. Because PPIE, they do have, people have different commitment, they have different priorities in their life. So we need to be flexible on how can we work with them in a meaningful way. So I've listed a few examples on ways to get involved or work with PPIE. So we work really closely, for example, with Raj in our grant application stage. So he has been influential in shaping our PPIE strategy. That was a big part in our funding application. We have also worked with service user in research prioritization process, where we brought together service users and policymakers in a room to have a discussion together, rather than policymakers have their discussions and then take it to service user. We want them to talk to each other, to understand each other's perspective. Regular project meetings, if they can. I know weekly meeting can be quite an ask, but if they can't do weekly meeting, find a way to keep them constantly informed of the project progress, so they understand what's going on. They feel like they have a grasp of what the project is moving, what everyone else is doing. And then another way, very good way to engage with them is to invite them to join the advisory panel or advisory committee. And then you can also organize an ad hoc workshop where you feel there's an important point where you would like to get a wider perspective. So for example, during scoping phase, you would like to test out your research questions or research design with members of the public or those with lived experience. You could organize a workshop, invite people with relevant experience to come to that workshop 1 hour or 2 hours, and then have the discussions with them to test out your idea. You'll be surprised how much input you get from that one single workshop. And then moving on to plain English summary, just like what Thea mentioned this morning, accessible paragraph. Make it, how accessible, transparent, but honest. So working together with members of the public, understand the language that they use, that they can understand. I think this is really, really important. And then we've also worked with our PPI colleagues to design our data collection tools. So for example, for interviews, so we conduct interviews with patients. So we work with our PPI colleagues to design the questions. What question, how should we phrase it in the way that actually makes sense to the people that you are interviewing? So that has been really, really helpful. And then finally, involve them in interpretation of findings and co-productions of research outputs and dissemination. So there are various ways that you can engage with PPI. You just need to be creative. So this is just some statistic that the reset PPI activities since October. So we have engaged with 21 PPI representatives. They've reviewed more than 20 documents. We have invited them to join more than 88 meetings. That's equivalent to more than 300 hours and 20,000 minutes. So we understand why it's important to do PPIE. We have a flavor on how can we engage with them. But what's really important is how to capture PPIE impact. How do you turn their feedback into evidence to showcase they have actually made changes to your project or to your evaluation. We all know that capturing impact is not an easy job. So we've brought this question to our PPI panel. We asked them. So they consistently told us they want to know how their feedback has influenced the project, how we have taken on their feedback. Because very often they commented on the plain English summary on the document, and that's it. They didn't hear anything back. They didn't know whether their contribution or their comment were useful. So they really want to know that. And then we asked them, what would be a good way to record, to kind of like feedback to you, to complete the feedback loop? And then they said, why don't you create a very simple table, like this one, where you record our comments and how you address them. So this is an example. So Raj kind of like suggested, how can we address accessibility and inequality issue in this particular project? And then that's how we address that. We said there are different referral mechanisms, and then we will map out the pathway and request further information. So we turn your feedback into action, and then we capture the action, and in the end, we'll come back to revisit this again and let you know whether your feedback has made an impact and what changes we've made on the project based on your comment. If we can't, take on the comment, we will tell you why we can't do it, and so forth. So we've included this feedback log on every project meeting agenda. So we revisit it every time we have a meeting, so we don't lose it. So just to give a bit of flavor on how PPI has influenced our work so far. So it has definitely helped shape our research questions and methodology. And then we have included additional questions during the scoping exercise, as well as topic guide for interviews as part of data collection based on their suggestions. And then we have co-produced a new format of participant information sheets for patients. So this is just an example. So it's very different to the typical participant information sheets you have seen. So we try to make it more digestible, more accessible. Credit to my colleague Rachel sitting at the front. She has been working with our colleague closely designing this. So let's pause here and think about what is the key obstacles or challenge doing PPIE, particularly in rapid evaluation. Can you slide it or raise your hand?
Either put your hands up or
Thank you.
slide it.
Recruiting representative people. Yeah, could you tell us a bit more about how you recruited those 21 people? Because that can be a key challenge, because if it's people who are confident in themselves, high health literacy, that tends to be the type of people who put themselves forward for PPI. And how do you hear from the people who don't put themselves forward?
And we've got on the board, we've got avoiding tokenism, time and infrastructure. Time, very large. I think that means lots of people have put that one in there. Diversity, building trust, engagement, process and funding. Should we keep that question and come back to that at the end? Is that okay,
Yep,
Paley?
it's
About time?
part of my presentation. Yeah, it's interesting, time. So what do people mean by time? Like we don't have enough time, or we are asking too much of PPI's time, or we don't have enough time to organize all these PPI activities. So it could be multiple, but we can discuss more of this during the discussions. I just wanted to cover, because today's conference is about rapid evaluation. So how can we build relationship quickly with PPI in rapid evaluation? I think it's very important to think about this from, when you engage with any types of stakeholders. So understanding their perspective is really important. Understand their motivation of taking part and their expectation, so you can manage their relationship more effectively, instead of having think, I'm not sure whether I should ask more of their time or not, or I'm not sure if this topic they are really interested in this. So understanding their perspective will be able to help you to tailor your approach and also build that relationship. So there's some element of active listening here, and then try to have an open communication or open conversation with PPIE. That will really help. Inclusive approach, like I mentioned earlier on, equitable participation. So they have equal level of participation as an equal member of the project team. And then provide support to them, for example, buddying or PPIE training. If they are new to PPIE, what would be the effective way commenting on the document? So you can share that with them, or even arrange them to buddy with another PPIE representative who are more experienced in doing this. That will really help. And then appreciation and recognition is really important. It's similar to when you work with any other stakeholder. You want to acknowledge them, you want to thank them, you want to really show your appreciation to their time taking part in your study, helping you in various ways. Because very often we work with PPIE representatives, they always went above and beyond to help out whenever they can. Next, feedback mechanism. So effective feedback mechanism is really important to help them, to kind of keep them motivated. They want to be part of this because they know that they're making a difference. Their input is help shaping something that eventually will improve the health and care system. So that is really, really powerful. And very last, finally, but not last but not least, no surprises. So managing the expectation. So I think the key is having that regular update with them. It's not like you don't talk to them for 3 months and suddenly you come back, our project, we've used up all our budget, so we have to end the project now. That's the last thing they want to hear, and the last thing you want to deliver to them. So, have the constant communication, no surprises, and, manage expectation. I think those are the key to build relationship quickly with PPIE. Flexibility is key. So no one size fits all, because in Reset we are doing multiple projects. We try to do things in the same way to all the projects, but the outcomes are different because all projects are different. We are all looking at different things, working with different stakeholders. The dynamic and the process are different. So we need, I think, allowing some flexibility to help you to adapt along the way. Just like Thea this morning, she mentioned she doesn't like toolkits, but toolkit work for some people. So in this situation, it might work really well for one particular project, but maybe not for the rest. So being aware of this and ready to change and adapt is also key. So we talk about why PPI is important, what stages we want to, is important to get their input. Let's move on to another very important question. How do we cost for PPIE? So in order to enable all of this, we need to have the budget. So how do we cost it to make it happen? Here are some of the key expenditures, categories that needs to be considered when it comes to costing for PPIE. For example, involvement staffing, like admin support, coordinator who help to set up meetings, processing, payment, etc. Involvement activities, for example, if you're hosting a conference like this today, you need to have the venue cost, catering fee, and so on. And then very importantly, payment and reward to PPIE. So in Reset, we follow the NIHR guidance, which is about £25 for an hour. And then, so this payment, and also provide training and learning opportunities to kind of like keep them, because it's a mutual beneficial process. So the research project beneficial from PPI input, but PPI representatives, they also want to grow in a certain way. So this brings back to our previous point, what motivates them to become PPI contributors, to want to involve in projects. If you don't have any payment at all, you could offer honorary appointment as a lay fellow or research partner in project. And then expenditures such as travel, subsistence, childcare, carer costs, and home office costs are also very important. There are other costs that should also be bear in mind are like translation or interpretation if you are engaging with, say, ethnic minority group. So those are, and then, and also disclosure and borrowing service like DBS application. There is a tool called NIHR Involve cost calculator. So if you Google it, so there's like a calculator that you can help guide you to plan your project to cost PPIE. I just want to give a few examples on, if you only have £100 budget, what PPIE can I do? So option A, you can have 8 meetings with 1 PPIE contributor, and each are half an hour long. Option B, you could organize a focus group, an hour long, with 4 PPIE contributors. Option C, you can get them to review a long document which takes about 2 hours, and you can ask 2 PPIE contributors to do so. And option D, invite them as a speaker for a conference, half a day. Okay, so moving on to where to find them. So from our experience, NIHR's People in Research platform has been very, very useful. So based on my personal experience, I remember I advertised a role back in September. I think within 24 hours time, I got 30 applications. So I think the key here is if you, when it comes to recruiting PPIE, you need to know who you're looking for and then include those information really clearly in your recruitment advert. So accessible language, clear role responsibilities, expectation, payment, and ways to get involved. And then you can advertise that on, say, for example, NIHR People in Research platform, or share it with the third organizations that you work closely with, or share it on social media, ask people to share, with their existing networks or contacts, and even approach other research teams, like Reset or Brace. If you already have an advert, come to us. We are happy to share that with our PPIE, representative. So that's everything from me. I would like to bring Raj back again, just to hear from his perspective.
Thank you, Bailey. Thank you. So I think in summary, for me, what did it give me? I think working together with researchers in an inclusive, in a collaborative, where diverse perspectives are deeply valued, and we continue to build these and sustain relationships for mutually beneficial outcome, has been an amazing experience for me. And why is it? I think if I sort of reflect and think about what is so special about Reset, the very first thing is I think the entire leadership team actually embraces PPIE fully. And I meant to say, when we talk about PPIE, it's not just the person who is with lived experience. We have Amanda, our colleague here. She's bringing her other profession as a PPIE person. And so am I. We're as PPI contributors. What you get is a person with not just the lived experience, is the full profession and all other experience, life experience. So it's actually quite an extensive range of experience. So these leadership team have so fully embraced it and demonstrated that commitment. And you heard Peli say how much there has been in terms of resources, investments, and really that kind of actually demonstrates that the second thing is shared decision making, or the governance, and in the way the Reset program is organized, we have a voice in almost in every way. In the executive management group, we have a voice in the project management group. In the stakeholder advisory board, we have a voice in the panel, etc. So it is really one of these. Kind of the shared decision making. Now the question is, how do you make that voice heard? And I think that voice heard comes from the earlier conversation about relationship and trust. If you have that trust and relationship and you speak up and your voice is going to be heard, I think that decision, and I know we can talk about these. I know Amanda has raised something before, as I have, and it's been heard, and as actually the project has actually done some of these things, and we can give those examples. I know when we were doing the grant application, I sort of said, look, we need to put a discovery phase before we even get into the scoping, and that was achieved. And similarly, many other things that has been done in a shared decision-making process. There's, it is an ability for me to learn about health. I mean, it is amazing how much you learn from these research programs and health. I know we talked about AI and a magical solution, and we're all working on an AI project. So much scope for all of us to learn, and that for me is another special thing. I think if I continue to go on, I know there is a huge advantage for all of us to do actually, anybody who is involved in this, any kind of health research is, anything like that you're involved today is, research today is tomorrow's health, really. And I think there are many other advantages, and I think I'll just pause here. We'll get some questions.
Yeah. So we've got 5 minutes, 10 minutes if we borrow a little bit of our generous tea break, to open it up and have some broader discussions. Thank you so much, Peli and Raj, for your insights, which has been really valuable to get those different responsibilities, different roles. So I'll open it up for comment, questions, reflections. If you just say your name, that'd be great.
Hi, my name's Jin. I'm a public health doctor in the NHS. Thank you very much, both of you, for your contributions. And I was trying to reflect on some of the work that I've done sort of through different organisations, and how in some organisations it feels much more natural and easy to do PPIE, and other ones where it feels much more sort of as an add-on, or you're just trying to force it through. And also trying to think about the tensions between, what we heard about trying to get PPIE involvement right from the start versus if you only have £100, how would you get PPIE involved? So I guess I'm trying to work out, is there a guide or a sort of way of thinking about what is a proportionate and pragmatic level of PPI involvement that is both not tokenistic and authentic, but also can fit within the bounds of the organisation or the project that you're working with? Thank you.
Thank you. Yeah, fantastic question. And I think for me, it is what you find is as you get into this, I think you'll find the balance in the way you have the people, and that will come from the relationship building process or investments that you make in that relationship, because very soon you will find that the people that you're working with actually will determine the balance, and I think you'll see that contribution, collaboration will come through that. The difficult question is then about how much resources or investments are you able to afford, and that sometimes is a really very because I think involvement without any recognition, whether that is financial or otherwise, is meaningless. And I think somehow that balance between resources and relationship is really where I see you will find a natural way of doing it.
Yeah, thanks for the question. I think leadership buy-in is very important because they are the budget, the decision maker when it comes to how much to spend. So I think it's making them to see the importance of PPIE, what can be achieved, what are the benefits, involve them in that conversation with PPIE so they have that first-hand experience. And from there, if they truly think, I hope, it's very important, they will find a way to incorporate it and influence everyone else within the project team. So I think leadership buy-in is very important.
Definitely agree with that, Paley. Any other questions? Got one over here.
Hi, thank you. My name is Bill Carroll. I work for a research organisation called SQW. And I just wanted to ask, I think it was really interesting how you described the PPIE involvement at a programme level, but then also at a specific project level. And I think there can sometimes be a bit of a tendency to see, PPIE as kind of one homogenous group or a kind of a conflation of people's lived experience when actually it contains a whole diversity in terms of conditions or in terms of services people engage with or kind of groups that people belong to. So I'm wondering to what extent, at the same time, it's not like involving someone with lived experience is something they need to have a very specific experience of a particular service. And I think people should, shouldn't put people into boxes like that. So is it about kind of achieving a balance between involving people with lived experience in relation to experiences that they can also speak to, but also in terms of your own recruitment here, do you have kind of a pool of people that you draw on? So yeah, just my question is kind of about how you achieve that balance between those two.
Yeah, thank you. I think the key is come down to your research question, what you're trying to do with your project. So if it's a project looking at, maternity services, you want to speak to those who use the service, who have experience. If it's more wider research topic like looking at outpatients, then you will be able to talk to maybe a wider pool of service users. So I think it's really it's like when you recruit for a new member of staff, you know what kind of key skills you want them to have. If they don't, you train them. So by really having a clear idea on what you're looking for, I think that will really help you to narrow down, where to find them, how to find, and who.
I think it's also worth saying that sometimes it's not a population group like a condition. It could be an age. We want young people. We want different sorts of people, and that's one of the great things about the work we do, but also one of the challenging things when trying to come up with a PPIE panel. We don't know as rapid evaluation centres whether we want 80-year-olds with dodgy knees or children with mental health challenges. We just don't know. So that's one of the particular challenges I think about building this kind of PPIE compared to, say, a project where you know who your population is from the word go. One more question at the back.
Thank you. Hello, I'm Lamia, and thank you for the very insightful conversation, and really makes me think like all of us and reflect. Just very briefly, so I sort of was immersed with our communities in Suffolk, especially those that tend to be sort of hidden from mental health services, so focus on children and young adults, and it takes a whole village to raise a child. So it was a lot of discussions with parents, grandparents, relatives, going to faith-based places, and a lot of distrust. And it was starting from, I think it would be shared experiences than lived experiences, because we all sort of were, introducing myself as a mum and going to the places. The one thing, my specific sort of the question I had, or question area rather, and one comment that I had, there seems to be a bit of a, well, not exactly a conflict, but when we talk about rapid, and as we said, it's at time, and trust building takes time.
Yeah.
So how could we sort of, again, without compromising on rigor, and coming from a researcher sort of, again, how could we not compromise the rigor, yet I think my question is that when Raj mentioned about in his conclusion about mutually beneficial outcomes, and that is something I got some excellent advice from one of our PPI members, a very wise lady, a teacher, who said, if you're looking to do something rather than shape the research question, you are looking to actually see what really matters to the people who matter most. And I think that is something which I'm just wondering, how do we, because again, the very practical suggestions were, how do we, what benefit will it, and people just sort of asked me after listening to lots of things, and they said, I said, just go on, take it all out completely, I'm here to listen. But then later, when we reached a sort of a linked sort of area, the main thing that came up was, how will it benefit us? Mm-hmm. So my sort of question really to the panel was, a humble sort of question is that how do we, given the time, real world sort of restraints, build that trust and that mutually beneficial outcomes within the rapid sort of world, rather. Thank you.
Yeah, sure. Yeah, I think it's an excellent question. I think again it will come to individuals. As Bailey said, when you talk about having that thought, step back and think, what are you looking for from involvement? And if you are clear in your mind what you're looking for, and you have that really complete commitment from the research point of view, and you know there is a need, and that need is justified by the benefits that people believe in, that any user involvement in any kind of projects at the front end brings benefits, and if you have that belief, then from a research point of view, that is done. It's then how does the involvement from public collaborators come in? And I think it is when you recruit people, you see that passion in them to learn, they have the enthusiasm, and that the relationship will come pretty natural if you have the right people that you've recruited. And I think from my experience, when I've seen a whole host of, in a number of different kind of environment where public contributors have come in, and even with us now, we work very, the group of people that we have together, we work really really well and gel together well. But that's only happened. We haven't really, in the present way of working, it's all online, most of it. Very rare we have a in-person meeting. But despite all of that, I think we've been able to build that trust and relationship. So my response is, I think you have to really put some effort at the front end, and you'll get the benefit.
Thank you, Raj. We've got time for one more question. Tina.
Right, this is a cheaty one, really, because I also co-PPI lead with Jenny, so I'm all for synergistic working, i.e. pinching other people's ideas. No, nobody laughed, oh dear. That's okay, I have worse jokes. No, I just wondered, reflecting, Raj, from the first round, like I have, of being, getting involved in, more heavily involved in the second time round. I mean, what do you think has changed? What have you learned? Because you wouldn't have stuck around if it was pants. That's a technical phrase we have in PPI, by the way. You wouldn't have stuck around. I wouldn't have. But what do you think? What do you think has changed, or what have you learnt that has made you want to carry on? This is the long game. Another 5 years.
Yeah. Fantastic, real deep insight. Because I think the biggest change is that we have a completely regular involvement in every project. In a Pear League outlined, we have a weekly meeting. We have continuous communication. It's really dependent on us as individuals how deeply we want to get involved. And the researchers like Holly and Rachel here will actually invite you to anything you want to. I mean, all the meetings are open to us when we want to join them, as we want to join them. I think the other part that is really changed is really a complete commitment that we want to actually make this happen, and we want to measure how impactful is it. And we continuously reflect and say, what else can we change? Well, how can we do it better? Where can we make more impact? And I think it's, again, Pear Lee who actually, if people don't attend meetings, she contacts them and has an individual conversation with them. So these are some of the smaller things, but they all add up in the belief that there is a complete commitment to actually have that impactful. Where we kind of also look is, where have we made the impact? And we actually make a big thing about that as well, so people know. Thank you. Yeah.
Well, thanks very much to Paley and to Raj for speaking to us today, and thank you all for joining in and sharing your ideas. I hope the conversations will carry on over tea and coffee, and we look forward to having more conversations with you. Thank you very much.